Welcome, everybody, to our webcast tonight, being hosted by the Pediatric Summit. That's going to be September 25th and 26th at Life University this year. Tonight, we have Dr. Dan Sullivan, who is going to delve into why we, as chiropractors, are the most relevant healthcare providers today. Dr. Sullivan, how are you doing tonight?
I'm doing great. Honored to be here.
Awesome. So I guess we can go ahead and get started. Dr. Sullivan, why are we as chiropractors the most relevant healthcare providers today?
Well, it's a good question. Since we kind of came up with the title of that, I suppose we should cover it. I think I want to keep it simple tonight. One of the things I want to maybe just propose, because whether you look at that title and you say, a chiropractor, this is the public, and this is why I'll start here. Which is the public thinks that chiropractic, they always think if I've got a major bad problem, medical doctor, hospital, whatever type of clinic, surgeon, that sort of thing. When they think of chiropractor, they think minor problem, they think back problem, they think maybe headache. And so what I want to get you guys to start thinking, I don't necessarily know who's watching, but whoever that is, whether you're a doctor, whether you're a chiropractor, whether you're a student, whether you're a patient, it's really the same message. And the same message is when we start to understand first and foremost the problem at large, meaning we've got a major crisis. And I don't think anybody would disagree with that, right? So we've got a major health crisis. So I was just thinking about it as I'm preparing. In fact, I was preparing for this. It's here it is we're on a Thursday. I'm preparing for some talks. I actually leave tomorrow to do a couple lectures for the weekend. Actually, I'll be doing 2 in one day, and so I've been really stressed out a little bit. I've been putting together PowerPoints and trying to figure this out and make sure these things are all coordinated. And then I start to sit down and I actually started to really prepare for this webinar and what what the topic could be. And I just started to get this thing inside of me that I just started to if we the world will, kind of drag you down if you don't realize this thing. And that is that there's a crisis out there. And the crisis is people are looking for solutions. People are looking for something different. They maybe won't say it, but they realize that what's currently happening isn't working out. And I'm going to go through some statistics with you. But the reality to start this whole thing is, if I'm here to say that you're the most relevant healthcare provider in your community, then we got to start with the fact that the cultural norm, or the accepted, status quo, or the accepted cultural authority in healthcare is not only not doing a good job, they're completely deceiving the public. And so here's where so my wife, she's involved. She's a natural Bradley instructor, which is natural birthing. She's involved with a lot of groups, and she always comes home with a story. Literally 2-3 times a week, she'll come home with a story, and it always reminds me, not that I need more stories, but we see them every day in the office. You see and you hear people, but the public that isn't necessarily directly involved with us, here's kind of what it comes down to. They're sick, they're suffering, they're looking for help. Their kids are suffering, they're sick, they can't parent like they want to. Their kids are hopped up on medications. And the biggest thing that just drives, and I think about this constantly, the biggest thing that drives me is that there's no hope, that they are looking for answers, and they keep going to doctors, and they keep getting prescriptions, or they keep getting recommended procedures, and there's no answers. There's nobody turning them in to say, listen, there may be some solutions here. There may be a different approach. There may be a different way to look at this. And this is where being the most relevant healthcare provider, that's where it starts, is to say, listen, we as chiropractors, we understand that the body is vital. We understand that there's a vitalistic perspective to the way life works, not even just health, the way life works, right? That, there's so many different ways to their ecosystems. I could make so many different analogies, but the bottom line is there's an incredible capacity in the body for heal. You think 2 cells came together and 9.5 months later, it didn't need any help. And you got this human being that formed. So we take it, even though that may be cliche, we take that and we go from there. So one of the things that I'll immediately go into as far as recognizing being the most relevant healthcare provider is the current statistics. So in 2013, the World Health Organization put out their findings or their report. And basically, United States, if you're in the U.S., we are in every category: efficiency, quality, costs, results. Overall, we were one of the poorest, actually the poorest in the industrialized countries. So you look at that, and then you start to ask yourself, and I just want to, I'm not the smartest guy, Caleb. I'm not like, and I always say this because I really am. I'm not. It took me, I can memorize and regurgitate with the best of them, like you do in school.
Mm-hmm.
But one of the things that I feel I would say gifted in, but one of the things I sense is that when you see all this stuff and the statistics, and then what I'm going to go over with you is what we have in chiropractic, the evidence that supports us, the fact that you are backed up by the best supporting literature there is, especially when it comes to the status quo or the cultural standard of the medical model, is that now we can actually take these ideas and say, that's the view. But what I want to, and actually impart in you today or tonight or whenever you're listening to this, is that's the view, but what's the vision? What's the vision for this stuff? And this is where I get that title. This is where I think about, this is one of my, I want to get this for the entire profession, to say that the view is the fact that, sure, the crisis is there, they're failing, we have answers, but the vision is that's a mom and a dad, or a husband and a wife, or a 12-year-old or a 2-year-old or a 56-year-old that are just looking for answers. And when you start to understand what you have as a chiropractor, or what you will have soon as a chiropractic student, what you will have, it starts to say, man, I've got a big responsibility. This isn't just, a game. This isn't just words that, to make it sound good. I honestly sometimes wish it was just better words, because that would mean that the problem isn't like it is. But the reality is the problem is like it is. And if the problem is like it is, that means that we have a responsibility in the midst of that to say, we have answers. And one thing I will not tell you is that this isn't going to be easy. And when I say this, I mean going out and becoming that cultural authority when it comes to healthcare, right? Becoming that doctor of the future. Like Thomas Edison said, the doctor of the future will no longer, right, give medications and no longer give drugs, but he will be the one that teaches and educates and works in the frame of the body and so, right? So we all know that quote. But the doctor of the future is going to be, what's going to be required of you is to confront that mentality, the hopelessness mentality, and the fact that there's a pill for every ill, and there's a diagnosis needed, right? So as we keep going, right? And I can tend to go off for a long time. Caleb, do you have anything, as pressing questions or anything as this, kind of go off here for a little bit?
Say that one more time.
I just wondered, do you have any questions? Everything making sense? I just want to make sure I'm not.
It's making perfect sense to me. Yes.
Okay.
Absolutely.
Perfect. I have a tendency to kind of just keep rambling on and on and on. So here's what I want to get into. I want to talk about back to the reality. I think it's important. In fact, I'm going to spend about 60% of the time on the current reality. Not my opinion. So there was, and this actually came from the Mayo Clinic. This came in 2013, and this was and this actually came in multiple places. Publishes that 70% of Americans are on a prescription medication. 70%. That means that 7 out of every 10 people that you meet are on a prescription drug. I always ask this to patients, small groups, large groups. I ask patients, how many of those 7 out of 10 do you think want to be on the medications? Of those 70%, how many want to be on the medications? So just think about that. And obviously the answer is obvious. And I'll give it the benefit of the doubt. Let's say 90%. Now we know it's probably 99.5, right? I had a patient one time that said, well, my mother-in-law, she loves her drugs. I'm like, well, let's say 90% then. So if 90% don't want to be on the drugs, yet that's their only solution according to their, solution to health, or where they go for health every week or every month or every year, called their medical doctor, then what they want is not matching up with what they're getting. So this is the important part, to say, although it's confrontational to address the certain idea in society that health comes from a pill or a potion or lotion, that you're also speaking to what they want. This is why I say we have a monopoly. I mean, we have a monopoly. We are actually offering solutions that don't require a prescription, but also at the same time, they're sane, they make sense. But here's the cool part, and this is where you can take this to the bank, which is, you're the most evidence-based healthcare provider. And when I say healthcare, I don't mean healthcare, right? So I don't mean healthcare provider, I mean health care provider. Because sometimes even in chiropractic, we get into this, these words, what do they mean? Health care is when you're trying to promote health or healing in the individual. Our current healthcare, right? Whether we kind of just lop that into one thing. Healthcare is, the diagnosis and treatment of disease. That's not what we do. Health care provider, right? That's what we do. So if 70% of Americans are currently on a medication, 25% of all children are on a medication for a chronic problem. That means that they're not soon to come off of that. That's a chronic, not just some sort of, Tylenol for a skidded up knee or a toothache. This is a chronic problem. 25%, 1 out of every 4 kids you meet, right, are on a medication, according to the best literature. 25 million pills are taken every hour in our country. 25 million pills. That was a 2009 Almanac of Chronic Disease. That's where that came from. 25 million pills. And listen to these stats. In 1988 to 2004, this is taken from the Journal of American Medical Association, not my opinion. 1988 to 2004, that's 16 years, the chronic disease for children doubled. It went from 12 to 26%. So from 12% starting in 88 to eventually went to 26% in 2004. That was chronic disease in kids. That's 16 years. In 2004 to 2010, according to the American Academy of Pediatrics, it doubled again. It went from 26 to 54%. Let me say that again. I want to make sure I'm not mixing my words. So from 88 to 04, it went from 12 to 26%. From 04 to 2010, in 6 years, what took 16 yeyears prior, it took 6 years to go from 26% rather to 54%. So again, we look at those numbers, and sometimes we look at them and just they don't mean anything to us sometimes, because it's like, I don't know what that means. But basically what it's saying is the amount of chronic disease in kids has doubled and just continues to rise. In fact, I think it was 2000. I won't be able to get this right because I remember it was actually 2010, probably 9 or 10, where it said that this is the first time in history that children won't outlive their parents. So that's the society that we live in. And I'm only going over the problem because at the end, when I, or soon here, when I go over the solution, the solution doesn't mean as much of a big deal if you don't understand the current crisis. That's where becoming the most relevant health care provider, and this is where, you got to step up into that certainty mentality. I'm on a mission to truly bring certainty to chiropractors and to chiropractic students and to our entire profession. And I kind of come from a background where I've got brothers that are medical doctors, and I've got mom that's a nurse, and that's kind of the way I was raised in that medical model mentality. I got a big family. My other sister's an occupational therapist, so I come from the medical model in a sense, and so I always feel like I've carried this burden on my shoulder to prove what it is that I do, what it is that we do. And so I always said I'm not going to say something that I know is not backed up. I'm also analytical in nature, but I'm not going to tell you something that I haven't seen the literature for, or at least the standard of care. That if there's not a certain other standard of care, like I don't think that chiropractors should be kept to a certain standard of care that the medical counterparts are or aren't, right? So I think we should have the same standard of care. Mm-hmm. So we go back to that and you look at those numbers, I guess the only thing that comes to mind, the biggest thing that comes to mind is that, the kids need your help. Families need your help. So here was another stat taken from the American Academy of Pediatrics. They found out that if a child took an antibiotic 2 times within their first 12 months of life, they were a 72% more likelihood to have to get asthma. 72% higher risk of asthma for antibiotics 2 times under the age of 1 or within the first 12 months of life. The other one you've probably heard, British Medical Journal. This was actually taken back in 1991, so it's an old study, but it showed that only 15% of all medical procedures are supported by good science or supported by the evidence. July 2009, this is more of a newer one, 5-6 years ago. 2009 shows, this is a Journal of American Medicine, July 1st, 2009, and this is one that I talk about a lot, is 2009. They showed that, they said, according to the data remains pretty clear that the health benefits that our current healthcare system provides does not outweigh the risks. So I think that sums up kind of the first portion of where I want to just establish why the world needs a new healthcare system, why our current model isn't working, and more importantly, how you can step into that role. And I don't mean be everything to everyone. That's not what I'm talking about. I'm talking about being a chiropractor, locating and adjusting subluxation, period. Right? I mean, if you want to add lifestyle stuff in there, go for it. I did a little bit of that based on the principle in practice. Lifestyle to be nutrition and moving your body. In the realm of a vitalistic, chiropractic paradigm. I'm adamant on that. But don't get me wrong. I'm not saying go be everything to everyone and diagnose and wear a white coat and make sure you check everybody's hearts. And that's not what I'm saying. I'm saying the current model, in fact, doing all that is going to get you into the same model that's already being done. And that's horribly, gone wrong, right? So that's not what I'm saying. I'm saying the current crisis is there. So being a relevant healthcare provider means that you got to do something different, right? Just to cap that, what this permeates, all that kind of the stats I just went over, what that actually ends up, it infiltrates every aspect of our living. So, for instance, if you go to Starbucks, right? Starbucks coffee spends, the organization itself spends more on healthcare than they do on coffee beans. They spend more on providing healthcare for their employees than they do on coffee beans, right? That's how bad our current model is. The other one is if you buy a car, General Motors has to add over $1,600 to every car sold. Every new car sold, over $1,600 is added to take care of the cost for healthcare. So just a small example of how that it trickles down to every aspect of our society. When you become a healthcare provider, I mean a healthcare provider, we're raising up the efficiency of an entire society in every way you can imagine. And so I'll kind of start to switch gears here, and I think that I'll bring up this guy. There's a guy named Harvard pediatrician. His name is Donald Ingber. You can look him up. Donald Ingber, I-N-G-B-E-R, Donald Ingber. And he's a pediatrician. What he actually came out to find out, he learned this. I learned this from Dan Murphy, actually. And basically, this guy found out that biomechanics, he read, there's a couple studies, one by Wang and one by, I can't remember the other guy, but they published these big papers. One of the titles of the papers was Biomechanics Rules Cell Biology. Biomechanics Rules Cell Biology. Basically saying the mechanics of the body actually influences the chemistry of the body. So this Donald Ingber actually kind of found this out, and he started looking into mechanics. And what he started to do, because he must have had an influence somewhere, and I won't know the whole backstory, but basically he went to the powers that be and said, we need to start to think about mechanics and implementing some level of mechanics into healthcare. And what he found out is the reason why, and I'll maybe ask you this, Caleb, why do you think, and I don't know if you remember this from last time, that I don't know if I even I did talk about this, so this will be a quiz for you. Why did they say there's no way that biomechanics, addressing biomechanics, will ever be applied to healthcare.
Why? Repeat the question one time.
So addressing biomechanics that we do as chiropractors, right? But there's other, industry or professions rather, PTs and osteopaths, so forth. There's other professions, even in the medical industry, that address mechanics. The way the body exists and functions in gravity, right? So finding this out and looking at this reports, he's like, man, it's pretty evident that if you address mechanics, there's a certain level of influence you're going to have on chemistry. Things that they would have never thought. I mean, things like hearts and lungs and stomach and hormones and chemicals, right? Biochemistry and liver and all this stuff. So he found this out. Basically, he went and said, we needed to start to figure out how to address mechanics better. And the powers that be, whoever that be, whether it be a board or whether it be a certain group of people, said there's no way. And there's one reason why they said there's no way we could ever have the medical community address mechanics, and there's one reason. Any idea? Any guess? Give me a guess.
A guess? Because it's free?
Yeah, dude, you're on the right track. You're on the right track. Actually, you're spot on. It's just another thing. So because it's free, what does that mean? What do you mean by that? Why wouldn't they allow that since it's free?
You can teach someone biomechanics, or you can train them how to do things a certain way, but that doesn't mean you can charge money for that, but it's not at the level that the current healthcare model runs.
Yeah.
Also, chiropractically, you can't just change the biomechanics because there's a reason that they're wrong.
Yeah. So you're right on the right track, and I'll just add the kind of the unfortunate truth behind what you're saying. And the bottom line was they told him, and obviously he was kind of pleading his case. They said there's no way we would ever do that because you can't put a patent on biomechanics. So if you can't put a patent on biomechanics, what can't you do? Just like you're saying.
Say that. I had a pop-up. Sorry.
No, it's okay. I said, if you can't put a patent on biomechanics, what can't you do?
Charge money for it.
Right. You can't. Exactly. You cannot own the rights, and you can't put it in a bottle and sell it. And so therefore, and it's just the thing. So what this means, right? When you got some of the best in the world, some of the greatest minds in the world saying like, wow, this should be probably addressed based on the evidence, and they're still going to reject that. I only point that out, guys, is because then the only people it's up to is us. You see, sometimes, and I'm guilty as charged, sometimes I think, well, man, if we could just get them the big idea, if we just get them this idea and just show them and more, I love the science because it's irrefutable and it's proven, and take it to the bank, and you can be certain and convicted and make sure you're speaking from this level of authority and you know outcomes and that sort of thing. I sometimes get caught up and think, man, if I would just show them, get me in a room with one of them and I'll show them and I'll prove it to them. But at the same time, I tell myself, I have to pinch myself and say, but it will never happen. They'll never do it because of the way certain things are run. And so when we start to grab onto that idea that you can't patent biomechanics, and they come out saying, all right, so we would never do it based on the fact that we can't bottle it up and sell it and therefore own the rights to it. But the truth is the truth, then, man, we better step up, right? Man, we got to step up and get at this. So let me just go through a couple studies. I mean, I could go through a handful of them, but I like to go through a couple. I want to keep it simple. I don't want to, get too crazy with you. But here's the thing. There was a study in 2011 by the study. It was a cyclotron study. It was out of Japan, and it was called the Ogura study, Ogura. And this guy, he's a chiropractor. He went to Life West. And he got a team of other doctors, actually. None of the other guys on the committee or the in the paper were chiropractors. which is actually advantageous to the cause. But what he basically found out is that when you make an adjustment occurs, you change the entire physiology of the human being because of the hypothalamus, because of what's in the brain. They found out that when you address the biomechanics, right? And I don't mean to get in a technique war, which, I know as a student, it's like there's all kinds of battles. I always say pick your battles, but I had my own share of battles. Believe me, I was a hardcore Gonstetter pretty much all the way through chiropractic college, and I've had plenty of battles and technique, and they're awesome. They're worth having. I mean, because you have them between your students, and you realize, you have to own your technique, you have to own your philosophy, you have to own that stuff. Do it. Get into battles with your classmates and that sort of thing. I'm here to say, addressing biomechanics, every single technique addresses biomechanics. And what I want to do for the profession is to show that by addressing biomechanics, right, a vertebral subluxation is a biomechanical issue. It affects a certain layer of the spinal cord, right? That layer of the spinal cord sends a couple different pathways. One, it goes up to the brain. The other one, it comes out as a neurological reflex into the sympathetic chain ganglia, and then it eventually affects a host of other things. But my point is, the science that backs this up is profound. So this Agura study in 2011, he came out and he showed that with a chiropractic adjustment, you decrease the sympathetic tone. And I know I'm kind of just jumping out of left field here because I didn't really set it up. A lot of the way that I believe, again, I'm going to go into my opinion here a little bit, that the way that we're taught in chiropractic college sometimes, and even some of the technique, seminars, is that the old theory of hard bone on soft nerve, although it's not wrong, and although it's not that it doesn't happen, it's not the majority of the reason why subluxation is so consequential. Does that make sense, Caleb?
Yes.
Okay.
Absolutely.
That's so vital to understand, because when you're talking to a patient, and I can, without a shadow of a doubt, with the highest level of conviction, say, listen, your spine is designed to be in a certain position, and it's designed to move in a certain way. And if it doesn't do that, there's complete evidence and research support the fact that your whole human physiology, every single aspect of human physiology is affected. And so one of the things that I'm super passionate about showing is that when you have a subluxation, right, an altered position and altered movement, it radically affects the neurology of the spinal cord. We have so many doctors in our profession that will still kind of cling to the fact that we're pain doctors, or that we're back pain, or that we're even spine specialists for that matter. We're nervous system specialists, right? We deal with the nervous system. The spine happens to have to be in a certain position and happens to have to be moving in an appropriate manner to get the right input up into the brain so that the body has full communication. And this is the thing that I just don't feel we're very well versed at. We're not taught this very well. It took me a lot of years. Believe me, I'm still in every day. I don't consider myself very smart. I spend a lot of time and I work hard at it, is understanding why a subluxation is so detrimental to the human physiology and to human health. And it has to go back. It goes back to that spine sends feedback, that the neural feedback that happens within all the receptors, these mechanoreceptors that are in the spine, around the spine, and in the facets, around these tiny little muscles, they're loaded in the spine. They send feedback into the brain constantly, every second of your life, and that dictates your life. It dictates your health, right? So, I could go through the studies that show that, but I'm gonna spare you the studies. What I want to tell you is that when you have an abnormally functioning spine, a vertebral subluxation it produces an abnormally functioning spine that increases the sympathetic nervous system. That triggers the hypothalamus. The hypothalamus sends stress hormones, increases stress hormones in the blood, and that actually has almost every aspect, every single chronic disease known to man, from heart disease to diabetes to cancer, you name it, has a factor of increased sympathetic tone and an increased level of stress hormones. And you have to understand that when you address that subluxation, when you locate, and you remove or correct subluxation, you are influencing the brain and all in neurophysiology. I want the profession to know this, is that chiropractic is more proven to improve visceral and systemic physiology human health as it relates to the organs and the organ systems, it's more proven to benefit that than it is to benefit musculoskeletal health, back pain, neck pain, headaches. But yet you go ask 100 people, what do they think chiropractic is? What do they say? Back pain, maybe neck pain, headaches. Maybe someone will say, well, I think they're quacks. I think they're crazy. I think, you got to understand a little bit where all that comes from and the AMA and the whole court case, that sort of thing. But here's the deal. I just want you to know, if you take anything away from this, I want you to hold your shoulders back, your head high, that as a chiropractor, you can bank on the fact that there's so much evidence to support what you do in addressing biomechanics. And even to go with the crisis, even if the crisis wasn't there, there's a certain level of human performance that's not addressed unless you address mechanics like you do as a chiropractor. And I just get so excited. I love chiropractic because of what it's taught me and given me and all the blessings in but more importantly, how I get to raise my kids and my family, and that I can have hope in the fact that there's a philosophy that I get to look at health as, and see where chiropractic, meaning the detection and correction of subluxation, where that plays a part. So there's other studies. I mean, I do have two more that I want to go over, and then I'll kind of wrap up and take questions. But the one thing to back up that Ogura study that I always go over with every single time I talk, there was a study in 2009, taken from Johns Hopkins University. It was a guy by name P.J. Fitzgerald, and he did the study. He showed that an increase of noradrenaline, right? So you're in the biochem or were recently, increase in noradrenaline or epinephrine and norepinephrine, those hormones. He showed that when you increase those, and I got to read this because it's a host of diseases that are directly related to an increase of epinephrine: cancer, glaucoma, bipolar disease, type 1 and type 2 diabetes, autoimmune disease, osteoarthritis, rheumatoid arthritis, excessive weight gain, hypertension, asthma, and immune problems. All of those are directly related to an increase in noradrenaline, right, or norepinephrine. When that study done, or that Ogura study showed that when you increase, so it showed that you decrease sympathetic tone. We know through the evidence back in Core's work of 1979 that when you increase sympathetic tone, another one was 1997 was the Jiang study. When you increase sympathetic tone, you increase catecholamines. You increase these hormones that have a direct relationship with chronic disease. You see me, I have almost like a physiology change, but I would go toe to toe with any doctor out there that would say, I just don't believe that. There's no more belief in it. This isn't a belief system. We change human physiology more than we do back pain or neck pain, right? So, and all these diseases directly related to sympathetic tone. Then you take the Heidi Havoc study. Heidi Havoc is, she's awesome. I mean, if you could get a webinar with her, which you should definitely try. I mean, currently the greatest researcher we have in chiropractic. She's over there in New Zealand. I mean, unbelievable stuff. The studies that she's putting out, and she's got awesome, anyway, she's doing awesome work. And so the 2007 study she did out of the Journal of Neurophysiology. So she's also a PhD. She was a PhD after she was a chiropractor. She did a study in neurophysiology 2007 that showed it wasn't because the naysayers or haters are going to say, well, do we know for sure that it was the adjustment that decreased that sympathetic tone, affected those stress hormones, and actually had an effect on all those diseases or chronic diseases, right? Well, she did a study that showed if you just moved the head around, palpated, and did some palpation and did motion or just some mobility, it did not affect the sympathetic tone. In fact, you actually go through that study. The other thing, that cool part about that study is she worked on all patients with subclinical neck pain. Basically what that means is they didn't have any symptoms. One of the requirements was no symptoms. One of the other studies, the blood pressure study that we talk about from 2007 out of Rush Hypertension Center, George Bacris, that was Dick Holtz did that. Marshall Dick Holtz did that study with the NUCA technique. They also eliminated all people with neck pain or previous neck or back pain, right, for the study. So there's no pain involved. And that study was great because there was no cavitation. So the double-blinded randomized controlled clinical trial that does this gold standard in healthcare, it was completely perfect in that, because the people that got the adjustment and didn't get they didn't know. There was no cavitation. They didn't know, oh yeah, I got an adjustment. And the other person, so it was completely double blinded. Nobody knew. And the blood pressure was reduced 17/10. So 17 systolic over 10 diastolic. That's how much the blood pressure was reduced with an Atlas adjustment. That would require 2 blood pressure medications. That's what the conclusion. You would have to take 2 blood pressure medications to actually get the same results as this adjustment. You see, it just start to stack it up. I mean, it's just inevitable. So I love that. So that 2007 study is awesome one. I use that all the time. Another one was, just a couple other ones. I won't go to the depth of the study, but 2 other ones that I always talk about. Today, the cutting edge healthcare today is a lot of them are talking about, anti-aging. In fact, there's been $268 million per year increase spent on anti-aging supplies in the last 5 years. So basically, people are looking for anti-aging. I want you to know that you are one of the best anti-aging solutions out there. If you're a student, you will be one of the best anti-aging solutions out there. Elizabeth Blackburn, who was a 2009 Nobel Prize winner, she went out, she did her work on telomeres. She found out that the way you actually decrease the size of a telomere, which is a good indicator, one of the best indicators on how much you're going to age, right? If you decrease the size of a telomere, you're aging quicker. If you keep it from, if you lengthen it or keep it from going shorter, you are, you're in the anti-aging industry, right? So you got everything from you could go get wraps at a, salon or a spa, to massages, to oils, to all kinds of supplements, right? That's just, people are buying it like crazy. Elizabeth Blackburn showed that the #1 way to decrease telomeres, you got to catch this. You got to catch this. Again, if you hear nothing else, the #1 way to decrease a telomere, the size of a telomere, is to increase the sympathetic tone in the nervous system. And even take it a step further, she actually showed it's increasing catecholamines. When you increase catecholamines, you actually will reduce that telomere. You will shorten that telomere, which makes, again, your age, you're going to age quicker. You're not going to live as long, the quality and or quantity of life. So, gosh, guys, I just, Richard Francis, another guy who's a PhD neurobiologist, what he showed was when you methylate when a certain, you guys have studied epigenetics, another major hot topic, epigenetics, expression of genes. It's not about the genes, it's about the expression, right? We know that we know that now. Well, one of the ways that you change epigenetic expression is you methylate the genes. How do you methylate the genes? Well, there's 3 ways you methylate the genes. There's 3 ways to best methylate the genes. #1 was an imbalance in B vitamins. #2 was toxicity, toxins in your environment or inside. And then #3 is an increase in catecholamines, which we can directly relay back to an increased sympathetic tone, which happens every single time there's a subluxation. I'll point this out. I don't know if you can you see this, Caleb, back here?
I can see about half of it.
I wish I could. How about that? There, that's better. So I just kind of put out, actually, you got me? I lost you there. Caleb? Can you hear me? Can you still hear me? Ethan, can you still hear? Oh, here you go. If you can hear me, I'll just keep going.